Lauren, tell us about the research that shows us, well, tell us about the case studies in humans, actually.
Yeah. So there's a good amount of case studies in humans from the perspective of mycotoxin as a food source. I mean, mycotoxins are just found in food, a lot of stored grains. So we tend to get a lot of data from developing nations where it's a lot of grain that they have in their diet. Also, make no mistake, we have a legal allowable upper limit of mycotoxins here in the US. That level is higher than some developing nations. Let's put that out there and let it be said. But you better believe no one is going to try to get the gold star for not having mycotoxins in their food, being completely void. Maybe a couple companies here and there that are hip to the groove right now, but companies, how they mitigate this is they'll put binders into a pile of corn that has fumonisin, and then they'll keep diluting it with fresh corn until they hit that legal allowable limit. So the reason why I share this is a lot of the data that we see with humans right now has to do with food input. And food input, as soon as it hits the stomach, it's gonna go systemic. And once it goes systemic, it's gonna land in the tissues, manipulate the hormones, everything. So whether you're inhaling it in the environment, the built environment, or you're consuming it, or you're having some type of transdermal exposure, it's still going to end up being systemic exposure. So a lot of the data, again, developing nations, food-based, but still something we can extrapolate to. So some of the developing nations are also very concerned about populations and making sure that people stay healthy. So you find a lot of data about children and pregnancy in these spaces, which is great for this, dialogue, because we're talking a good amount about women here. And we have seen in these studies that mycotoxins undoubtedly pass into the breast milk from mother's diet, so go systemic again. And we also see that they pass through the placenta, to the point that when mom's diet potentially has high enough, something like fumonisin, there can be neural tube defects that can lead to miscarriage, to fetal death and miscarriage. And then we also even see that something like alternaria toxin can degrade estradiol, which is really important for keeping that nice juicy uterine lining, for keeping that baby healthy and protected. And we can see a degradation of that estradiol, which can, essentially really wreak havoc on the pregnancy, including pregnancy loss. So there's just a lot of data, food data, about mycotoxins in pregnancy, and even postpartum. And that's where that breastfeeding component really comes in. And
it's really important data, Lauren. I want to stop for a second here and say something to women who are trying to get pregnant, right? Women, I see a lot of women in my practice, they keep having miscarriages before they come to me, and they don't know why. So then they try IVF, they try other things, it's still not working. And this is just something that's overlooked. Sure enough, I'm going to do a whole panel of detoxification labs, of toxin labs, including mycotoxins. And it's very, very often the case that I'm finding mycotoxins are high in the patient, along with other toxins. That ties in with the, the conversation we just had, the part of the conversation we had like 10 minutes ago about toxins and their interplay together. And so bring it right back to here. Women who are trying to get pregnant and it's not working, it's important to look at the mycotoxin panel and the other environmental toxin panels. And then, of course, we do a lot of detoxification therapies, and voila, they're able to get pregnant.
Right.
Takes some time. So what you're saying about the research, we see it clinically every day.
Absolutely.
Yeah.
Absolutely. And again, this is the estrogen, progesterone component too that we have happening there. So not only just the toxic effect to the fetus, but if we step back and we think about, well, what about earlier in life where puberty is happening with young girls? There are some, again, cohort studies where they're looking at people who have been incidentally exposed where there was a group of very young female children in the 80s who were exposed to zearalenone. And I have to check this data every time I say it, because I can't believe it. But it says it in black and white writing. They noticed that these girls who had high levels of zearalenone in their blood were developing precocious puberty, so early puberty, as early as 6 months.
Whoa.
To 8 years. And precocious puberty could mean breast buds. It could be, it doesn't necessarily mean that these 6-month-olds were menstruating.
Right.
But it's still like, oh. And here's the thing with zearalenone is it's so strong when it comes to being able to sit on our estrogen receptors that it ranks up there with our own estradiol. And in animal studies, we have seen it be 2 to 3 times more aggressive at sitting in that estrogen receptor compared to animal estrogen.